Hey everyone, welcome back to the Happy Flosser podcast. This is a podcast that helps dental hygiene students feel confident, supported, and grounded as they move through one of the most intense programs out there. I'm your host, Billie, and today we're going to dive into something that can be truly changing your academic life. I hope this helps you guys. Evidence-based study strategies. I've been doing some research and I want to share what I have discovered. If you have ever spent hours rereading your notes, highlighting entire chapters, or watching the same lecture twice and still felt like nothing stuck, you're not alone. And more importantly, it's really not your fault. Those strategies feel very productive, but they don't actually create long-term memory. Today, I am going to teach you the study methods that research shows actually work, especially for the kind of high volume, high demand learning that you all do in dental hygiene school. Let's start with the big myth. Rereading and highlighting. They are not effective study strategies. They make you feel really busy, but they don't actually challenge your brain to retrieve information. And retrieval, pulling information out of your memory, is really what strengthens your learning. Think of it like instrumentation. You don't become great at scaling by watching me or someone else do it. You become great at scaling by doing it, by practicing the motions, by feeling the fulcrum and adapting your pressure. Studying works the very same way, guys. Your brain needs to practice recalling the information, not just re-exposing itself to it. So, research in cognitive science consistently shows two strategies that outperform every single thing else. So, why not lean into those? Active recall. Active recall means that you force your brain to retrieve information without looking at your notes first. It is uncomfortable at first, guys, I'm not going to lie, but that discomfort is part of the learning. And the second evidence-based science is spaced repetition. This means you revisit information at increasing intervals, day 1, day 3, day 7, day 14, day 30. Spacing your reviews strengthens your memory far more than cramming. So together, these two strategies can create durable, long-term retention, which is exactly what you need for clinic, for competencies, and most importantly, for boards. So let's break down some practical ways to use active recall in your daily study sessions. All right, closed book questions. Before you open your notes, ask yourself, maybe you're doing perio. So you ask yourself, what are the steps of the periodontal assessment? And actually go through the steps. What are the eruption dates of the premolars? And actually try to retrieve that information. What are the contraindications of nitrous oxide? And see if you can come up with those contraindications. You want to try to answer from memory first, then check your notes. All right. And I love flashcards, but flashcards only work when you use them for retrieval, not for recognition. So one question per card, answer out loud or in writing, and then flip it over to check. You could do a whiteboard brain dump where you just literally set a timer and for 5 minutes you write everything you remember about a topic on your board. Don't look at your notes, dump your brain, and then take a different color marker and fill in the gaps so that you can see what you need to study. A teach back method is really awesome as well. Explain a concept out loud as if you are teaching a patient or a peer. If you can teach it clearly, you can understand it. So talk to your water bottle. Tell your water bottle all about it. Okay. Saying it out loud, you have two ears and only one mouth. So you're going to have better recognition of what you're aware of and what you can recall. And then you could do a case-based recall. So maybe you create a mock patient scenario Maybe a patient with generalized moderate periodontal disease, or a child with a mixed dentition, or a patient with a high caries risk or xerostomia, whatever that is. And then you're just going to recall the steps, what you would do in the assessment, and then the decisions that you would make based on that case. This is one of the most powerful ways to connect the classroom knowledge to your clinical thinking. But before we keep going, guys, I just want to share something that can really make these strategies even easier. I have a Happy Flosser companion workbook that includes active recall prompts, space repetition trackers, study session templates, weekly reflection pages, and clinic assigned clinical case studies. If you want a structured way to study smarter, not harder, this workbook was designed exactly for you. It is built to support your learning style as a dental hygiene student. So let's talk about spaced repetition, the strategy that prevents forgetting. Who couldn't use a little bit of that? So your brain naturally forgets information over time, and that is completely normal. But when you revisit information right before you forget it, you strengthen the memory. So here's a simple spaced schedule that you can use. And I lay this out in my companion workbook, but I'm totally fine sharing this all with you here. If this is going to help you, I never hold anything back, guys. It's all just there for you. Day 1, you learn the material. Day 3, you do a quick review. Day 7, you do a short active recall session. Day 14, maybe you do a flashcard or a brain dump. And then day 30, you do a final review. Now, I lay out this spaced repetition differently when I'm tutoring students or I have someone who has a board exam coming up and we know that there's less time than 30 days going on. So I'll lay out this spaced repetition based on their specific needs. But you get the idea. This is the generalized framework. And this schedule works beautifully for things like anatomy, for perio, for radiology, pharmacology, board preps, things like that, because short spaced sessions outperform long cramming sessions every single time. And the thing about dental hygiene school is all these courses are like interwoven. So when you do these spaced repetitions, it's really going to help you. Maybe you've already finished radiology, but doing this little spaced repetition in radiology is going to reconfirm your ability to do radiographic interpretation or identification of an anomaly or really advanced perio. Where's your clinical attachment loss and where's the bone level on this patient? Like all of these different courses all tied together. So by giving yourself that opportunity to revisit the content is going to deepen your knowledge and understanding. So let's build an evidence-based study session together. So walking through a single study session should look like this. You're going to start with retrieval. So before you open your notes, ask yourself questions. Try to answer from memory. And then don't reread every single thing. Target your weak spots. This is what I love telling students to do. If you have done a study session, so say yesterday you studied something, at the end of that study session, take a 10-minute pause, come back, sit down and take a white piece of paper, write down everything you remembered from that 1 hour study session or two, whatever length of time it was. See if you can actually retrieve all the information that you learned. And then go back and look at your notes and try to find the gaps, right? Target those weak spots by finding the gaps. Then save that piece of paper because the next time you sit down to cover that content, you'll study the gaps first because that's the stuff you had a harder time remembering. For some reason, our brain really likes to study what feels good and feels easy because our brain is all about efficiency. So having two different color inks and knowing where the gaps are for yourself, knowing the stuff that you're having a hard time retrieving, that's the stuff you're going to focus on. I tell students, just don't reread everything. Target your weak spots. And by targeting the gaps, that's exactly what you're doing. And mix up your topics because, like I said, dental hygiene school, it's all interwoven anyway. Don't just focus on one topic at a time. Blend your perio and your anatomy and your radiology because this is going to improve your long-term retention and really prevent burnout. And before you close your notebook, schedule your next review. even a 5-minute revisit. Do some habit stacking, right? In 2 days, I'm telling you, that makes a huge difference. You're going to notice how you feel different. It'll hit different over the course of the semester if you're doing like 5-minute revisits in 2 days and you do a 20-minute, I'm going to look through these flashcards. Maybe you're going to do a brain dump. Maybe you're going to tell someone, right? Explain it to somebody, a key concept. This routine is simple, repeatable, and is backed by lots of research. So active recall doesn't just help you guys pass your exams. A lot of you guys think this is just for your didactic courses. I'm here to tell you it also helps you in clinic. When you practice retrieving information regularly, you will make faster clinical decisions. You will feel more confident during your assessments. You will remember those steps under significant pressure. It's going to reduce your anxiety. It's really going to strengthen your professional judgment. And your brain is just going to become more agile, more responsive, and really more prepared for real patient care. As you guys move through dental hygiene school, remember this. You don't need to study harder. You need to study smarter. Active recall and spaced repetition are powerful, evidence-based tools that will support you through every exam, every competency, and every clinic session. I encourage you to try one new strategy this week. See how it feels and trust that you are building strong, scientific, foundational skills for your future as a clinician. I'm really proud of you for showing up for your learning. You're doing amazing, and I'll see you in the next episode.